We should remember that this debate over health care is not confined to just this week, and it is certainly not confined to this building or even to this mainland. Yesterday, I held an emergency roundtable with the leading healthcare leaders in Massachusetts. These are the healthcare heroes who provide compassion and treatment each day to their patients. They all spoke poignantly about the devastation that would come from repealing and replacing the Affordable Care Act. Dr. Peter Slavin, the president of the Massachusetts General Hospital, said to repeal the Affordable Care Act would be a horrible sin for this country. But that's exactly what the Graham-Cassidy bill is. It's a cruel and inhumane sin that would damn millions of American families. In some cases, this most recent Trumpcare proposal is even worse than the failed bills before it. The bill proposed the use of a totally subjective formula, which was changed at the whim of the bill's sponsors to entice more Republicans to vote in favor of it. The bill was nothing more than something that had political plastic surgery that had been performed, but it was fundamentally the same bill. At the roundtable I held in Boston yesterday, Dr. Henry Dorkin, the president of the Massachusetts Medical Society, said that, quote, "I fear that if Graham-Cassidy were to pass, we would go back to attending more funerals of children." There is simply no reason to go back to a time when people died of preventable or treatable conditions simply because they did not have access to insurance. Just moments ago, we learned that the Republican leadership will not hold a vote on this disastrous bill. They simply did not have the votes. And right now, millions of Americans are again breathing a sigh of relief. I applaud my colleagues, Senator John McCain, Senator Susan Collins of Maine, and others in this chamber who are calling for a bipartisan process to strengthen and improve our health care system. We have done it before on the opioid crisis. We have done it on Alzheimer's and other medical research funding, and I still believe we can do it here. We need to do what we have done so many times before and focus on bipartisan solutions instead of partisan exercises. I hope that we can put Graham-Cassidy and other Trumpcare proposals behind us and embrace bipartisan negotiations led by Senators Alexander and Murray to stabilize the individual health insurance market. Senators Wyden and Hatch introduced bipartisan legislation to reauthorize the Children's Health Insurance Program for 5 more years just last week. There are a number of bipartisan healthcare issues that need immediate attention this week, such as the funding for community health centers and extending the number of Medicare policies. This bill was not our only option. It isn't really even an option, at least not for those Americans with pre-existing conditions who are on Medicaid or who need opioid treatment. We need to work together in this chamber to improve health in a way that works for all Americans, regardless of where they live or who their governor is. That is the responsibility of those who serve here. And now, let us have a new beginning where we begin to work together to solve those problems. Mr. President, I yield back the balance of my time.